This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
So with us being in flu, viral winter season, I want to talk about kind of an interesting case that I had last year during this season. So something we see lots of adults and kids with GI bugs and diarrheal illnesses, but last year I had a kid who was a 3-year-old who came in who had a day of what seemed like a fairly typical diarrheal illness, but it had a seizure. A couple things that we think about when a kid has a seizure and they're having what seems like possibly an infectious but diarrheal illness. So some of the big things that we definitely always want to rule out are kind of the hypoemias, so like hypocalcemia, hyponatremia, hypoglycemia, because those are all electrolyte abnormalities that can cause seizures. But also hyperkalemia, can induce arrhythmias and syncope and can look like seizure. So that's why those kids definitely need labs drawn. If the kid's fairly sick appearing, that expands the differential a bit to hemolytic uremic syndrome, which is just a pretty sick kind of bacterial diarrheal illness that'll have AKI and anemia and a couple other electrolyte abnormalities. And then we also really need to look for toxic ingestions. So like salicylates, lead, iron, a lot of the toxic ingestions that can make kids pretty sick and also just have diarrhea as a part of it. And so that's something to just think about. If a kid's pretty sick and has diarrhea, it still is worth thinking, does this kid really have an infection or is it an ingestion and we're maybe going down the wrong path? But this kid looked really good. His labs were totally normal. Didn't have a fever, but it had this seizure. And so I ended up talking to pediatric neurology. We ended up coming up with a diagnosis, which I had actually not even heard of until diagnosing this kid, which is called Benign Convulsions with Enteritis. So essentially viral, enteritis, viral diarrhea with seizures. And so apparently it's something that's not terribly common, but was first identified in like the 1980s in Japan, because it's a little bit more common in Southeast Asia. But it's actually very similar to like a simple febrile seizure. So, kids in the kind of 6 month to 6 year age range, if they have a fever, it can just induce seizure. And there's certain kind of low risk criteria where if you meet those criteria and have one seizure and you're back to baseline, those kids usually get to go home, with a simple febrile seizure. And in the same way, if a kid has a diarrheal illness and has a seizure with pretty much the same low risk criteria as a simple febrile seizure, they also get to go home. So this kid was back to baseline. He had one seizure in 24 hours and it had lasted less than 15 minutes and his lab work looked normal. We actually were able to reassure the family this was a totally normal thing. It's not going to predispose him to epilepsy in the future or have any kind of big issues. And the kid was able to go home and had a good outcome. So that was something I just had never heard of, just something to kind of add to the differential of if you have a kid who ends up with the workup being fairly benign, thinking about benign seizures with enteritis, which is just one more thing for us to sort of add to what we're looking for during the winter seasons.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.